Welcome to the deep dive. Our mission is pretty simple. We take all the sources you send our way, the articles, the research, and we boil it all down to the absolute essentials for you.
And today we're diving into cardiovascular health, looking at some material that really flips the script on how we think about preventing heart attacks and strokes.
Yeah, we're going after root causes today, and then we'll get into some specific foods that are presented as, well, better and more natural alternatives to medication.
It's a huge reframing of the whole problem. You know, for decades, the entire conversation has been about cholesterol and this slow, gradual buildup of plaque in the arteries.
Blockage.
Exactly, the blockage. But what these sources hammer home is this. 80 to 90% of heart attacks and strokes, they actually come from an acute clot.
A clot, not just a slow-moving traffic jam in the artery.
Right. The clot is the sudden catastrophic event. That's the emergency.
Okay, let's unpack this.
Yeah.
Because if the clot is the real villain, then it suddenly makes perfect sense why blood thinners became the go-to preventative tool, aspirin.
Precisely. For a long time, the thinking was, okay, the small benefit of reducing clotting risk is probably worth the small risk of side effects.
And that's where the recommendation for everyone over 60 to take a baby aspirin came from.
It is. But that's all shifted now, post-2022.
So what changed? Why the big reversal?
Well, the trade-off started to look a lot worse. Aspirin, it works, it thins the blood, but the side effects, they're not so minor.
Right.
The sources we looked at really highlight the risk of internal bleeding. We're talking about bleeding ulcers in the stomach and much more seriously, bleeding in the brain.
Wow. So it's not this harmless little pill you take every day.
Not at all. And for a lot of people who aren't at super high risk, the dangers now clearly outweigh the benefits, which, puts a huge spotlight on finding a natural alternative.
One that gives you the anti-clotting benefit without those specific bleeding complications.
Yes. But before we get to the solution, there's this really fascinating statistic about timing. The sources say almost half, nearly 50%, of all heart attacks happen between 6 a.m. and 12 noon.
Just that 6-hour window. That's incredibly specific. Why the morning?
It's all about stress hormones. As soon as you wake up, your body just floods itself with cortisol and adrenaline to get you going.
And those are clotting agents?
They're potent clotting agents. They basically activate your whole coagulation system, so that morning surge of hormones can be the exact trigger that turns a stable situation into a disaster.
That's genuinely unsettling.
And if you want to see how powerful that connection is, look at something called broken heart syndrome.
Stress-induced cardiomyopathy.
Right. The sources say that after the loss of a loved one, a person's risk of a heart attack or stroke can go up by 2,000%.
2,000%.
2,000%. It's just profound proof of how these emotional and physiological stress hormones can dramatically spike your clotting danger.
Okay, so that puts the power of cortisol in a whole new light. If stress is the trigger, and we want to avoid drugs like aspirin or even warfarin, which blocks that blood superglue from forming, what's the natural route?
What's fascinating here is that the answer lies in a specific part of omega-3 fatty acids, specifically a component called EPA.
EPA, eicosapentaenoic acid.
That's the one. You always hear about EPA and DHA together, but when it comes to stopping platelets from getting too sticky and forming clots, the sources are clear. EPA is the real powerhouse.
So how does it pull that off? How can it be as effective as a low-dose aspirin without the bleeding risk? That sounds a little too good to be true.
It works on a totally different part of the mechanism. So think of it this way. Your blood platelets have this key ingredient that makes them sticky, right? Which you need to heal a cut.
Sure.
Aspirin and warfarin kind of block the final step of that stickiness process. But EPA, it gets in there much earlier. It actually replaces that sticky ingredient with itself, making the platelets just fundamentally less grabby.
So it's not thinning the blood, it's making the blood cells less sticky to begin with, like a subtle Teflon coating.
That is a perfect analogy. And the benefit is twofold. First, you get the anti-clotting effect. But second, EPA helps stabilize the plaque that's already there.
How does it do that?
By seriously decreasing the inflammation in that area. When the inflammation goes down, the plaque becomes stronger, more stable, and much less likely to rupture, which is the event that usually kicks off the final clot.
That stability part is huge. So you're tackling the chronic issue, the plaque, and the acute risk, the clot, at the same time.
Exactly. And There was a big study cited in 2019. It found patients taking EPA had a significant drop in plaquing, inflammation, and a massive 25% reduction in overall cardiovascular events.
And what about the morning cortisol spike? Does EPA help with that too?
It does. And this is where it's like a dual defense system. Beyond just the mechanical effect on the blood, EPA also has a mood effect. It's been shown to help lower your circulating levels of cortisol and adrenaline.
So you're hitting it from both sides. You're reducing the hormonal go signal for clotting, and you're making the platelets less able to respond anyway.
That's it. It's a very robust approach.
Okay, so where do we get this powerhouse EPA? I mean, fatty fish like salmon, mackerel, we know about those. But the source material said we can take it to the next level.
Yeah, the specific recommendation is cod liver oil, and preferably wild caught. Because while you can get EPA from regular fish oil, cod liver oil packs it with two other critical vitamins for your arteries, vitamin A and vitamin D.
Vitamin A, retinol. I usually just associate that with eyesight or skin. What's it doing for arteries?
Think of the lining of your arteries, the endothelium, as your body's internal skin. Retinol is essential for repairing that internal skin, just like it repairs your outer skin. It's a powerful anti-inflammatory and has been shown in animal studies to actually decrease atherosclerotic plaquing. It's about fundamental repair.
And vitamin D. We hear about it all the time, but not specifically for the arteries.
It's incredibly effective. One study cited found that out of 1,000 different compounds they tested, vitamin D was the single most effective at preventing damage to that internal artery layer. Yeah. It decreases how stiff the arteries are, helps stabilize the plaque, and this is key. When you have enough vitamin K2, it helps reduce calcification in the arteries. It keeps them flexible.
Okay, so we've just laid a huge foundation here with EPA, vitamin A, vitamin D, directly targeting clotting and repair. That's a ton of info on natural alternatives.
It is, and honestly, this barely scratches the surface. If you're finding these ideas compelling, we really encourage you to go deeper and look at the source material we analyzed.
For those of you who are intrigued by the science here, you can find a whole library of detailed videos on the YouTube channel of Dr. Berg DC. Now, let's jump back into why our arteries fail in the first place. Here's where it gets really interesting. We've said the plaque is the bandage and the clot is the killer. But what's the actual injury? What's the wound that needs a bandage to begin with?
The root cause is something called endothelial damage. The endothelium is just a single super thin cell layer that lines every artery in your body.
Just one cell thick.
One cell thick. And when it gets injured by toxins or high sugar or inflammation, that's when the whole cascade starts. First comes inflammation, then the body rushes in to patch it up.
And that patch is the plaque, the calcium, cholesterol, and protein. It's a repair job.
It's an internal scab. Exactly.
Yeah.
Calcium for structure, cholesterol is a building block for cells, protein to bind it. We've spent decades demonizing the scab materials instead of asking what caused the wound.
So when that endothelium gets damaged, what's the one critical chemical we lose?
Nitric oxide. Or NO, this is everything. Nitric oxide is a vasodilator. It tells your artery walls to relax and open up, which increases blood flow.
And when it's gone?
When NO production drops, you get three huge problems. One, you lose blood pressure control, so you get high blood pressure. Two, your clotting risk goes way up. And three, the artery wall itself gets thicker and stiffer.
So high blood pressure and clotting are direct results of just losing that one protective chemical. It's all connected.
Completely. And you know, the sources mention a few simple, natural ways to keep NO high.
What are they?
Things like getting sunlight, which provides vitamin D and infrared rays that stimulate NO, breathing through your nose, which generates NO in your sinuses, and making sure you get enough magnesium.
Speaking of simple, let's talk about the source material called exercise in a cup. We're talking about cacao powder.
Yes, and this is a really powerful tool, but it has to be raw cacao powder, not the roasted processed cocoa you find in the baking aisle. Raw cacao is just loaded with these things called flavonols.
Okay, but why exercise in a cup? That's a pretty bold comparison.
Because of a study they cited. It found that the vasodilation effect, the widening of the blood vessels from drinking this cacao, was comparable to the effects you get from medium-intensity exercise.
So it mimics a workout. How does it do that?
It's not just adding nitric oxide to your system. It actually stimulates the enzyme machinery in your body to make more of its own nitric oxide. It's like it's rebooting the factory.
And it's cumulative, right?
Yes, that's the fantastic part. You drink it daily, and it helps your arteries basically relearn how to make NO again. It restores the function over time.
That idea of relearning sounds like actual anti-aging for your circulatory system.
The evidence points that way. There was a study on 50 to 80-year-olds. After just 14 days of daily cacao, the thickness and flexibility of their arteries were comparable to people 20 to 30 years younger.
That is a profound reversal of stiffness.
Mhm.
So for people who want to try this, what are the rules? How do you prepare it right?
Two absolute musts. First, you mix it in warm water, but never boiling. The heat will destroy the flavanols. It's a raw product.
Okay, no boiling water. What's the second rule?
This one's critical. You have to avoid drinking it within 2 hours before or after of drinking coffee.
Really? Why no coffee?
Because caffeine is a potent vasoconstrictor. It narrows your blood vessels, so you're drinking the cacao to dilate your arteries, and then the coffee comes in and constricts them. It's like hitting the gas and the brake at the same time. You just cancel out the benefit.
That makes perfect sense. Any other additions to make it even better?
You can add things like beetroot juice powder, which is a direct source of NO, or just a little sea salt, or even some magnesium glycinate to help the whole process along.
If we connect this to the bigger picture, we've talked about tools for the clot and the artery wall, but we have to talk about the diet that causes the damage in the first place.
Right. To really reverse this, the sources are clear. You have to change your lifestyle.
We know cholesterol is just a repair material. So once that plaque is there, how does the body actually clean it up?
There's a mechanism for that. It's called reverse cholesterol transport, or RCT. It's the body's natural cleanup crew. It takes that plaque from the artery walls and brings it back to the liver for recycling.
And how do we switch on that cleanup crew?
The sources list a few key things. Niacin, which is vitamin B3, having high levels of HDL, your good cholesterol, regular intense exercise, fasting or just not eating so frequently. And this is a big one, a low-carbohydrate diet.
And that low-carb piece brings us right to the #1 cause of the damage: sugar toxicity.
This is the ultimate root cause. For the average person, refined carbs and sugars make up, 45 to 65% of their daily calories? And the scale is just shocking.
What do you mean?
Well, your normal healthy blood sugar level is equal to about 1 single teaspoon of sugar in all the blood in your body. Just one.
1 teaspoon. And how much are people eating?
The average is somewhere between 50 and 100 teaspoons a day.
50 to 100. That's toxic.
It's incredibly toxic, especially to that delicate endothelial layer, and so the body has to deal with it.
Which is where insulin comes in.
Correct. Insulin's job is to act like a vacuum cleaner. It frantically sucks all that toxic sugar out of the blood and shoves it into fat cells to get it out of the way, and that system works for about 15 or 20 years.
And then what?
And then the pancreas gets exhausted, insulin stops working as well, and you get prediabetes and then full-blown diabetes. That constant high sugar environment is what's causing the inflammation and injury day after day.
And the low-carb diet stops that process cold.
Exactly. Excess sugar gets converted to cholesterol. It causes endless inflammation. The low-carb approach is so effective, it can remove 40% of the fat from your liver in just 2 weeks. It sets the stage for recovery.
Last thing, we need the right minerals to manage all this.
Yes. Magnesium and vitamin K2. Magnesium is the master controller of calcium. Arteries need calcium to contract, but they need magnesium to relax. It's essential for blood pressure.
And K2 tells the calcium where to go.
Precisely. K2's job is to take calcium out of your soft tissues, like your artery walls, and put it where it belongs, in your bones and teeth. It prevents the arteries from calcifying and getting stiff.
So what does this all mean? We've just analyzed a whole natural toolkit for artery health, one that's presented as a really powerful alternative to just being on pharmaceuticals for the rest of your life.
Yeah, we've covered 3 huge strategies. First, cod liver oil for that anti-clotting EPA and the repair vitamins A and D. Second, raw cacao powder every day to boost nitric oxide and reverse stiffness. And third, the foundational low-carb diet with key minerals like magnesium and K2.
You know, the biggest takeaway for me isn't just the list of supplements. It's this powerful idea that our arteries aren't just destined to get old and clogged, that you can actually, through things like the cacao, teach them to be healthy and flexible again, to function like they did decades ago.
It really shifts the focus. It suggests that our diet, our foundational nutrition, is the real driver of whether we decline or we reverse the damage.
If these concepts have sparked your curiosity and you want to dive even deeper into the science behind all this, don't let the learning stop here.
You can find a wealth of detailed videos, including the source material for this deep dive, on the YouTube channel of Dr. Berg DC. Go check it out and continue your learning journey.